The correct answer here is all except number 2. So it doesn't produce bile, but it is a reservoir, it secretes mucus, and it concentrates. Which of the following statement is correct regarding Budd-Chiari syndrome? Correct option is T, that is abdominal discomfort and ascites are the main presenting symptoms. It usually affects females, and venous drainage of the liver is occluded by IVC thrombus. That's not correct, it's hepatic vein thrombus. It's not IVC thrombus, it is hepatic vein thrombus. So abdominal discomfort and ascites are the most common presenting factors. Which of the following is correct regarding splenic artery aneurysms? Let's go to the correct answer here is B, that is, it is usually situated in the main arterial trunk. Correct regarding splenic artery aneurysm is that it is usually situated in the main arterial trunk. Okay, let's go to the next one. (28). 28 says, which of the following statements are correct regarding primary survey management of traumatic head injury patient? So all statements are correct except third one. The correct answer here is C. So let's see. Ensure adequate oxygenation and circulation, exclude hypoglycemia, and check pupil size and response. This is correct. Check for mechanism of injury, that is not in your primary survey. (20th). Which of the following statements are correct regarding ABCDE of trauma care? Correct answer is your C. So the correct statements are: A stands for airway with cervical spine protection, B stands for breathing and ventilation, D stands for disability neurological status, but C stands for control massive external hemorrhage. That is incorrect. 30. Which of the following statements are correct regarding inguinal hernias in children? It is more common in full-term boys. Should be repaired promptly. It is always indirect. This is correct, but it may frequently be transilluminant. That is incorrect. So the correct answer here is A. Transilluminant will be your hydrocele. Vibration white fingers refers to Raynaud's phenomenon. That is your B. Which of the following are criteria for cancer screening? Screening test should be sensitive and specific. Correct. Screening test should be acceptable to screen population. Yes. The disease should be uncommon one for screening to be effective. That is wrong. Uncommon disease, we don't screen for uncommon disease. Disease should be recognizable at an early stage. That is also correct. So the correct option here is your B. A 45-year-old lady presents with complaints of fatigue, muscle weakness, along with bilateral renal calculi which were picked up on a routine ultrasound. Further workup relieved serum calcium levels of 11.4. What is the next best investigation required to arrive at the diagnosis? So hypercalcemia, you will do a system AB scan for checking parathyroids. Okay, 34. Which of the following are the etiological factors associated with the communicating hydrocephalus? What are the causes of communicating hydrocephalus? The answer is C here. So, post-hemorrhagic, correct. Lesions within the ventricles, that is not correct. CSF infection can cause it, and raised CSF protein can also cause it. So communicating hydrocephalus is your post-hemorrhagic CSF infection and raised CSF protein. Because lesions in the ventricle will cause obstructive hydrocephalus, not communicative. Which of the following statements are correct regarding a brain abscess? The correct option here is B, 1, 2, and 4. Abscesses arise when the brain is directly exposed as a result of fracture or infection of this air sinus. That's a correct statement. We are talking about brain abscesses. Then, presenting features include low-grade fever, confusion, seizures, and focal deficit. That is also correct. MRI will contrast is the initial imaging modality of choice. This is incorrect. CECT. Remember, CECT is the initial investigation of choice for brain abscess. The etiological agents include bacteria, fungi, protozoa, and viruses. Yes, it could be either of them. 36. What is the common type of tumor of vermiform appendix? It is your carcinoid tumor. The earliest specific cystoscopic appearance of bilharzial cystitis is Cystosoma hematobium. What is the cystoscopic appearance? Sandy patches. Which one of the following best describes craniosynostosis? It is the premature fusion of one or more renal sutures, preventing growth perpendicular to the suture. 39. A 60-year-old female presents with pain in her back of recent onset, which has become severe of late. During the course of investigation, she was found to have lytic lesions in the vertebra and ribs. Which of the following organs should be carefully screened now for detecting the primary cause of this disease? You should see her breast if there is any secondaries from the breast. Which of the following statements are correct regarding quota equina syndrome? Correct answer is B. So let's see. Its presenting symptoms are perineal numbness, painless urinary retention, and fecal incontinence. Yes, that happens. Then urgent investigation with MRI is required. Yes, it is present most commonly in 55 to 60 years of age. That is not true. Confirmed cases require early surgical decompression. That is true. Okay, so let's see. Quota equina actually is more prevalent in the middle-aged individuals between 40 to 50 years of age. So it's a close option. Coming to OBGY now. Which of the following statements about hysterosalpingography as an operative procedures are correct? Tubal patency assessment following tubioplasty operation. That is correct. Diagnosis of uterine synecdoche. Yes, correct. Detection of IUD. No. Yeah, we can detect IUD in HSG. Diagnosis of subserosal fibroids. That cannot be done. So the answer here is A. Which of the following are indications of endometrial sampling? Endometrial tuberculosis. We can do TB assessment here, but it's not an indication. Endometrial polyp, yes. Postmenstrual bleeding, yes. Abnormal uterine bleeding, yes. So the answer here is D. A 30-year-old lady, para 3, living child 3, female, presents in gynecological emergency with acute abdominal pain and vaginal bleeding of short duration. She gives history of tubal ligation after birth of third child. On examination, right agnostal tenderness was found and os was closed. What is the probable diagnosis here? Okay, so this is a type of ectopic pregnancy. Failed tubal ligation. It's not PID because there is no bulging or there is no bleeding. Complete abortion, you will see the os is closed. This is an incomplete abortion. Which of the following statements are correct regarding audit in obstetrics and gynecology? It can replace the out-of-date clinical practices with better ones. Correct. It is an efficient educational tool. Correct. It should be based on scientific evidences with facts and figures. Correct. It is not labor intensive. That is incorrect. It is labor intensive. So that's one. Which of the following are poor prognostic factors in endometrial adenocarcinoma? So, estrogen and progesterone receptor positivity. That's not a poor factor. HER2 gene expression, that is a poor prognosis. Histological types, papillary, serous, and clear cell, that is a poor prognosis. Aneuploid tumors, that is a poor prognosis. The answer is T. Clear cell, papillary, serous, poor prognosis. For which of the following conditions surgery is indicated for fibroid uterus? Symptomatic and failed medical management, true. Size more than 12 mm, true. Pedunculated fibroid, true. All are indications, 1, 2, and 3. Which of the following is a measure without any straining while examination under POP-Q system? That is your TBL. TBL without straining in POP-Q system. TVL means total vaginal length. So that is done without straining in POP-Q. Which of the following are criteria for opting Lee-Ford's operation for surgical correction of pelvic organ prolapse? Okay, so procedentia in old age, it's an indication. Unfit for long duration surgery, it's an indication. Coital function no longer required, that is also an indication. But associated uterine pathology, that is not an indication. So answer here is T for Lee-Ford's. Operating on Bartholin ducts is in the, answer is A here. Opening of Bartholin duct is in the vestibule outside the hymen at the junction of anterior 2/3 and posterior 1/3 in the groove between the hymen and labia minus. Which of the following are EMSL's diagnostic criteria? Vaginal pH more than 4.5, positive whiff test, presence of glue cells more than 20%. Vaginal culture is not a criteria, so culture is not a part. Which of the following are nodal complication of maternal diabetes during pregnancy? hyperbilirubinemia, it should be hypocalcemia. Cardiomyopathy, hypoglycemia. So your answer here is, see, you can see hypocalcemia here. Which of the following are predictor factors for fetal growth retardation? Low level of maternal first trimester beta HCG, that would be a high level. Low should be your papa. So that is incorrect. Abnormal uterine artery Doppler at 20 to 24 weeks of pregnancy. Fetal echogenic bobble on ultrasound. Maternal medical disorder. Yes, that is true. So the answer here is D. Which of the following of the primary is of primary surveillance tool in the growth retardation fetus? It is umbilical artery Doppler. Glands of Cloquet are for the lymphatic drainage of the vulva. Cause of AUB are subdivided by the acronym PALM Queen. What are the characteristics of PALM causes? Structural regions, diagnosed by ultrasound, confirmed by histopath, all of them. Daily suppressive therapy for HSV1 and HSV2 is valacyclovir 1 gram twice daily. Which of the following are the primary organisms involved in PID? And gonorrhea, chlamydia, mycoplasma hominis, but not Candida albicans. So A is Candida albicans is not a part. It causes vaginitis, not PID. What is the characteristic of dermoid cyst? It is a germ cell ovarian tumor, bilateral in 15 to 20% cases, and torsion is common. Rupture is not so common. So the answer is D here. Germ cell ovarian tumor, bilateral 15 to 20% cases, torsion is common. Which of the following is not a differential diagnosis of chronic inversion of uterus? Fibroid polyp, fungating cervical malignancy, cervical prolapse, Gartner's cyst, that is not a indication. So correct answer is D, the wrong one. Chronic inversion of uterus can be your fibroid polyp, then fungating cervical malignancy, cervical prolapse. A 28-year-old P2L2 presents to the gynec OPD with complaints of malodorous vaginal discharge. On examination, the discharge was found to be grayish red in color and adherent to the vaginal walls. Which one of the following bedside diagnostic test for the causative organism? Your positive 10% potassium hydroxide test. Okay, positive 10% potassium hydroxide test. When you do it, you will see fishy odor. We are suspecting what? We are trying to fulfill the criteria for bacterial vaginosis. Okay, so we'll do the next 60 in the next video.